The ICU nurse roles and responsibilities in the KSA. Early morning, once after taking the endorsement, she need to check all the vitals. However, the monitors are completely connected to the patients, but still she need to take the ECG and keep it ready so that once the doctor comes on rounds, she can show it on. We need to clarify what the infusions are going on to the patient. That is very important because once the doctor comes to the area, he immediately asks you what's the ratio of the medications, dosage of medication for the patient is on. Then every second hourly we need to keep on changing the positions of the patient. That is very important because here we are having the KPIs, key performance indicators, where the pressure injuries are on a very high concern. So keep on changing the positions of the patient after massaging. Here, very one unlucky thing for the nurses is we do not have any of the portal or the helpers for the nurses. If nurse is alone and no good staff along with her, no friends, then she need to suffer a lot. If you have a very good friend to help you out, then definitely they can help you in doing the changing of positions of the patient. As well as we need to take care of patient in order to provide care for the patient. First of all, the ICU nurse should be very competent enough. She need to pass all the examinations as well as competencies over here, are under observation of your clinical instructors and the nurse educators. As in the India, I have not seen the staff will be get judge under the CI or nurse educators. Here in each hospital we are having the clinical instructors and the nurse educator, and nursing education administration is available in the KSA, which is like a very plus point for the nurses over here. They guide us, they keep us motivating, they teach us the policies. Every hospital are having different standards. As I have worked in the India under the National Accredited Board of Healthcare in the India, as well as here in the Saudi Arabia, I am working under the Sibahi Central Board of Accredited healthcare institutions. Here we are having a broader aspects of the competencies we need to go through, as well as we need to have a BLS certified, and in the ICU we need to have ACLS certified. So moreover than till the nurse continue the care for the patient, then the doctors may give some change in the prescriptions and all. We do not follow here the 12 hours protocol in the hospitals. We follow the SMAT, that is the military timing 24 hours protocol. And here we the monitors they are having the specific data which will be saved back of us, so we cannot able to delete any of the vital signs data. It immediately show to the investigators if anything have gone wrong to the patient. The nurse cannot able to safeguard themselves. So here the nurses of especially ICUs and ER, OR, they need to be very cautious with the patient condition. Closely monitoring is very important. Then should provide the oral care for the patient in the morning. Actually here 12 hours shift is there, so early morning compulsory oral care, and the bathing is sponge bath is given to the ICU patients, and suctioning to be done under close monitoring again, because suction again causes like aspiration or sudden cardiac arrest for the patient. So nurse should be very cautious during performing the very critical procedures for the patient, as well as the nurse should carry the MAR while preparing the medications for the patient. MAR is the medication administration record, that is the charting of the medications. So this is highly very you need to be very specific while providing care for the patient, especially in the critical care areas. And Saudi Arabia, really they focus on the patient concern than the staff concern. However, most of the nurses are very excellent, and we try to do much and more better things, so we can able to do it. So this was just a little bit what I have thought of sharing with you. So if you really like the nurse, critical care nurse, you can come over here. The packages are very excellent. 1,20,000 for the Indian nurses especially. That is the very basic one, which will be in the starting, and every year we will have the increment of 5%, especially if we are working under Ministry of Health, that is the government services in the Saudi Arabia. The environment is not much good as in like a very lavish hospital, but we can able to have like more allowances, and they concern with our extra fares a lot, as well as over time if we are going to have like triple the amount of the normal salaries. So this is very good for a good package in your pocket you can able to receive. So that's it. If you have any concern, please like, share and subscribe.